Hello, and thank you for joining me on another episode of Alex Talks Nursing. This week's episode, we're going to discuss asthma. I'm going to go ahead and explain what asthma is, how it affects your body, the different kind of medications we use to treat it, and lastly, I'll bring in a special guest where we'll kind of describe ways to get your asthma under control. Asthma is a syndrome characterized by airway obstruction. Asthmatics have a special inflammatory pattern along their lower airways that make them more prone to surrounding triggers. These triggers cause their airways to narrow. This results in reduced airflow in and out of the lungs, wheezing, and difficulty breathing. The people most at risk for asthma are those with atopy. This is a genetic predisposition to asthma. Those with atopy also commonly suffer from other allergic symptoms such as runny noses or maybe even eczema. A little bit more about asthma. Asthma typically targets the lower airways, the bronchioles. Along the bronchioles, there are activated inflammatory cells that cause inflammation all along the lower airways. There are also cells there that are producing excess secretions and mucus. This causes other inflammatory cells in the body to become involved. The smooth muscles in the airways contract and increase airway secretions. Eventually, the smooth muscle becomes inflamed and swollen and from being contracted for so long. This results in the narrow airways. Mucus plugs also form from the extra secretions created, eventually resulting in clogs in the airways. Through all of this, the body will attempt to cough and get rid of all the secretions, resulting in respiratory distress. Lastly, it should be noted that 1 in 13 Americans has a diagnosis of asthma. When treating asthma, you are typically prescribed two different kinds of medications, a long-term acting medication and a short-term acting medication. Long-term acting medications are taken on a daily basis and make it less likely that you will have a severe asthma attack. The most common form of long-term medication is corticosteroid. This is a steroid that is used to control the inflammation in the lungs. They are generally safe for long-term use and are given through the form of an inhaler. Leukotriene modifiers are oral medications. The most common are Singular and Zyflo. These medications prevent spasm of the airway muscles, most typically during exercise. Sometimes the doctors will prescribe medications called long-acting beta agonists. The most common is Ceravent, and this is used to open airways. Doctors may also prescribe combination inhalers, which are a combination of the previously mentioned medications. Lastly, there's theophylline. This is a daily pill that is taken to keep the smooth muscles in the lower lungs relaxed, though this medication isn't prescribed as often as it used to be. Your quick relief medications are medications typically used during an asthma attack or in emergencies. The most common form of quick relief medication is a short-acting beta agonist. These medications act within minutes to loosen the bronchioles to relieve symptoms. Xopenex and albuterol are the most common. These can either be taken from an inhaler or a nebulizer machine. What the nebulizer machine does is it turns the medication into an easily inhalable mist. Atrovent may be used in more severe cases of chronic asthma. Lastly, in the emergency room, they may give you a corticosteroid through the IV or orally. These will relieve airway inflammation caused by serious asthma attacks.
So for this next portion of the video, we're going to be talking about how to prevent asthma attacks and how to keep your asthma well controlled. Today, for this part of the show, I'm joined by my very special friend, and probably the best ER nurse I know, Mrs. Elizabeth Ronquillo. So the first crucial step to controlling your asthma is learning to identify and avoid your asthma triggers. So one effective strategy to do that is to create a log and describe what was going on around your asthma attack. In this log, you should take special note of what you were doing, where you were, how you were feeling that day, what you possibly ate, maybe it could be a food allergen, and what was the environment like, what was the temperature. Triggers that can initiate an asthma attack can be anything from irritants such as pollen or dust, animal dander or cigarette smoke can irritate and cause an asthma attack. Temperature or infections can worsen your asthma. When the weather gets cold, that can cause an asthma attack. Also, maybe physical activity is causing your asthma to get worse. Also, if indicated by a doctor, sometimes allergen testing can help us identify triggers for asthma. The next step to keeping your asthma controlled is to take your asthma prescriptions as prescribed.
So normally your doctor will give you two medications, a fast-acting inhaler and a long-acting one. The fast acting will be for emergencies when you can't breathe, and the long acting is usually taken daily. First one, metered dose inhalers. These are usually the puff ones, and you'll open it up. See, normally breathe all of your air out, put it to your lips, and breathe in as you release. Woo.
And then after that, you'll want to hold the medication in as long as possible, and then exhale. Also, after you're finished taking your meter dose inhaler, you'll want to go ahead and brush your teeth and rinse your mouth out.
All patients using a metered dose inhaler should also use a spacer. A spacer is a device that will help get more of the medication into your lungs. What the spacer is it connects to the mouthpiece of the metered dose inhaler. The inhaled medication goes into the spacer tube. You then take about 2 deep breaths to get all the medication into your lungs. Using the spacer will waste less medication.
So for the long-term medications, as Liz kind of said, these are the medications that you're going to be taking on a daily basis. These are the medications that are going to keep your asthma well regulated. So it's very important to take them on a daily basis, even if you're feeling well and you feel like you don't need it.
And the quick relief medications, those are for when you're having an emergency, when you realize that your chest is tightening and you can't breathe. So when your symptoms worsen, you take a puff, see if it improves. If it doesn't, you want to make sure that you go to the ER to get treated.
Quick relief inhalers are great for loosening tightened muscles around your airways. But if you notice that you're using your rescue inhaler more than twice a week, you probably need to see your doctor to change up your regimen. So the next step to keeping your asthma controlled is learning to track your asthma and recognize when your asthma may be getting worse. The best way to do that is to use this device. This device is called a peak flow meter. So what this device does is it measures your lung capacity. It measures how well you're pushing air out of your lungs. You can find these over the counter at most drugstores, and most times you can often get it from your pediatrics office. So right here, you'll notice that you have a mouthpiece right here. You have a handle that you open. And then right here, you have a gauge that measures the amount of air you're pushing out. So how you do this is you're going to want to reset the indicator to 0. You're going to want to sit up straight or stand up. Take as deep breath as possible, and then you'll blow straight into the mouthpiece. After doing that, you'll want to reset the indicator, and then you'll want to repeat twice more, so that way you have a total of 3 readings.
So your next step will initially be dividing into zones. This will be done by your doctor most of the time, but your first zone will be green, then yellow, then red. So the green area is when your asthma is well controlled. So this will be the time that you feel good, you're able to breathe out well, maybe after treatment, things like that. Yellow is the caution area. If you're anywhere in the yellow, you'll start taking a rescue inhaler or breath, check your symptoms, make sure that nothing else is going wrong. If you're not feeling well, make sure that you go to see your doctor soon. The last one is the red zone. Red zone is 50% of what your green area was, and if you're ever in this area, that's an emergency. That's when you have to be seen in the ER to get another treatment, albuterol, Atrovent, and possibly a steroid to help open up your lungs.
So overall, the key to keeping your asthma controlled is consistency. You always want to make sure you're using your peak flow meter. You want to make sure you stay on top of your medications and you're taking your long-term medication as prescribed. And really, you just want to be adamant about your asthma attacks. You want to know what's causing it, and you want to be able to kind of know what to do when it happens.